Hey everybody, it's Tony Turbyville with Platinum Benefit Services once again, and today we are going to talk about Medicare supplement insurance plans and how they interact with Medicaid for long-term care. So if you got this video, it's because the best we can tell, you have a standard supplement insurance policy that could be supplement that you have bought and you pay a premium for on a monthly basis. It may be through your retirement plan. It's most common that you're paying for it out of your pocket. Now, it's important to understand this is not the same as replacement plans. So it's not an HMO. It's not the kind where the insurance company pays your 100 and whatever a month for Part B to Medicare. You're going to have a premium for a regular supplement insurance, and it's important that you know that regular supplement's different than the replacement plans. This is not about replacement plans. This is about regular supplement insurance. Typically, if you're paying a premium, it's regular supplement insurance, okay? Now, as always, we're not attorneys. We're not giving you legal advice. We're not telling you what you should or shouldn't do. We're not insurance agents. What we're telling you is how the Medicaid and Medicare system works, how it intertwines with long-term care coverage, and then you should talk to appropriate legal or insurance advisor, legal counselor and insurance advisor, all right? So Medicare does provide rehabilitative coverage. That rehabilitative coverage is for 100 days per coverage period, okay? Here's the criteria for coverage. Number one, you must be admitted, not held for observation, actually admitted to the hospital. Now, there's a difference. You can be in the hospital for several days for observation. Doesn't work for Medicare coverage for rehab. You must be admitted, and you must spend 3 midnights in the hospital. You must be discharged from the hospital and then enter the nursing home either directly, which is the most common, or within 30 days of discharge from the hospital for something directly related to the reason you were in the hospital, and you must do that within 30 days of discharge from the hospital. If those criteria are met, then you'll be covered under Medicare. Now, if you have been in the hospital recently, right, in the last 60 days you've been in, and you've used some of your Medicare days, then you don't have all the Medicare days left. You have part of them left. So, for example, you fell, went to the hospital, got 60 days, let's make it 70 days so it doesn't get confusing, 70 days of rehab, and then you went home. You ended up having a problem. You went back to the hospital 30 days later, came back to rehab. Well, out of the 100 days, you haven't had 60 days of wellness. So you already used 70 days. So you have 30 days left of Medicare rehabilitative days, okay? So if you've had less than 60 days of wellness, but you haven't used the whole 100 days, then the remainder of the 100 days can be used, and you can go through that process, multiple times to use up those 100 days. Now, once the 100 days is used up, you don't get another 100 days. You're paying out of pocket unless you have 60 days of wellness. And that 60 days of wellness is truly, you don't need rehabilitative services, not just, okay, we ran out of coverage, so we're not going to get rehab for 60 days, we'll wait. You have to have not needed the rehab and then come back after 60 days, then your 100 days resets and you start the process all over again, okay? So in short, Medicare covers the first 20 days of rehab in full, 100% of it. Days 21 through 100, it covers at 80% of the bill, as long as you show the potential for improvement, okay? And a true Medicare supplement insurance, not a replacement plan, but a true supplement, will cover the 20% that is not covered by Medicare days 21 through 100. So first 20 days in full, Medicare. 21 through 100, Medicare for 80% and supplement insurance for the other 20. Now what if you don't have supplement insurance? Well, if you qualify for Medicaid, Medicaid will pick up that 20%, or you can choose to pay the 20% out of pocket and continue to get the rehab. So those are the three ways. And of course there could be long-term care insurance, but it's pretty rare in that 100-day window. Benefits can be discontinued at any time during the 100 days, including the first 20, although rare, it is possible if the patient fails to show the potential for improvement. Medicare only wants to be writing a check to the nursing home if they're doing something to help you. If you can't be helped because you're not willing or it's just not going to be possible, then they must remove you from the rehab days. Otherwise, they're going to be guilty of Medicare fraud, which facilities lose their license or their Medicare billing privilege. They don't want to do that. So be aware. Okay. Keep the applicant's supplement insurance, we think, is the right thing to do during the 100 days. I have never personally seen a scenario in which it made sense to get rid of supplement insurance during the Medicare rehab days. Can you? Sure. Should you? We don't think so, but again, please get appropriate advice. All right. Again, only cancel on the advice of the attorney or insurance agent. But here's some facts. The Medicare supplement insurance is a great product to have. There is no question about it because it fills the gaps that are not covered by Medicare, but that does not mean it covers long-term care, but it does cover a lot of other gaps. So it covers gaps in the doctor visits. It covers a lot of the copay stuff in the hospital, including the admittance deductible, which is approaching $2,000 these days. The nursing home rehabilitative services, it's going to cover that, as we've already explained, up to the 100 days. But it's not going to cover long-term nursing home care, regular home health care, or assisted living care. And it does not cover prescriptions unless you sign up for a Medicare Part D plan, which is another type of supplement. Okay, the regular supplement insurance everybody thinks of, doctor visits, hospitals, rehab stays, and you want to keep it for that if you can. Okay, now why wouldn't you be able to? Well, affordability. If it's affordable, most people do choose to keep their Medicare supplement insurance. Well, why would it not be affordable? We'll get to that in a minute. But Medicaid reduces the patient responsibility to the nursing home by the amount of the premium for the supplement insurance. Okay? You'll see it here in just a minute. We'll lay it out. The Medicare supplement will then cover what Medicare does not, up to 100 days of rehab. Now, remember a minute ago we said Medicaid may kick in, right? Because remember days 21 through 100, if you don't have the supplement, Medicaid will kick in. But even if you do have the supplement, all those benefits end at 100 days, right? So after the rehab ends, Medicaid will kick in and pay for the long-term care in a nursing home. Now, these days in Florida, that long-term care costs between $9,000 and $11,000 per month. Okay, Medicaid's going to pay virtually all of that, but there is a calculation to determine how much does the patient themselves owe. Okay, think of it as a Medicaid deductible, if you will, even though that's not technically correct. So let's look at a scenario where we might want to keep the insurance. Now, the only time you would not want to is if you're married and you need the money to help your spouse. So we're going to look at two married scenarios. One where they're going to keep it and one where they're going to drop it. If you're single, you should virtually always keep your supplement insurance, in our opinion, but not direct advice, okay? So let's take a couple where the person in the nursing home has a gross monthly income of $3,000. They get to keep $130 a month for their personal needs. That's everybody in the state of Florida. $130 is the allowance. Let's assume the supplement insurance premium is $300 a month. And let's also assume that the Part D plan that the nursing home advised the family or the applicant to sign up for costs $50 a month. And let's assume that based on the calculations that we go through to determine how much can the person in the nursing home give to the spouse at home, it's called spousal diversion, how much in this case is the spouse at home going to get? Let's say $1,000. So once we subtract all of those numbers out, that leaves $1,520 that the patient in the nursing home is going to have to pay to the nursing home every month. Again, think of it as a Medicaid deductible, okay? So the patient's portion of that $9,000, $10,000, $11,000 a month bill is $1,520. The key here is that they can pay the entire spousal diversion of $1,000 and there will still be money owed to the nursing home. If they couldn't pay the entire amount that was due to the spouse, okay, there wouldn't be anything due to the nursing home, which is not our concern. It's just if there's nothing payable to the nursing home unless it balances to the penny, you're going to have to pay something to the spouse. Well, let me back up. So the key here is that the person in the nursing home has enough income left after the deductions to pay the spouse whatever the diversion amount is that was calculated. In this case, it's $1,000. The person can pay the $1,000, okay? And a kind of a way to see that quickly is there any patient responsibility? If there is some, then that means that the spouse in the nursing home had enough income to pay all the expenses, including the spousal diversion, and still owe something to the nursing home, so that shows that they can pay the spousal diversion. Let's go to another scenario, also married. But in this scenario, we won't want to keep the insurance because the spouse living at home needs the money from the insurance premium. And give me a minute and we'll circle back to, well, what about not having insurance, okay? So in a cancel scenario, let's suppose that the person in the nursing home only had $1,000 a month of income. They got to keep $130 for personal needs. They got $300 in premium for the supplement insurance. They have a Medicare Part D, just like above, which is $50. Well, the subtotal is there's $520 left. You started with $1,000, you took out those deductions, but if the patient responsibility was the same as the other one above and it was $1,000, the spousal, sorry, I said patient responsibility, the spousal diversion was the same $1,000. Well, if you try to take $1,000 from $520, you're short $480 that you can't pay the spouse at home, even though Medicaid says if you have it to pay them, you can pay it to them. Well, we're $480 short, so we start looking at, hey, how can we get that $480? Well, if you cancel the supplement insurance, that's $300 a month, right? The spouse is generally in control of the finances, so the spouse may be able to use that $130 for things that help the patient but also help themselves. The Part D plan, I would generally say don't cancel that because Medicaid does not cover prescriptions and you don't want to end up knowing the nursing home. But the point here is that this person is way short. They can't pay that insurance premium and still give the spouse at home the money they need to live. Now, keep in mind that canceling the supplement insurance is okay because if the person miraculously recovers and comes out of the nursing home, it is a life-change event which will allow them to sign back up for the supplement insurance if they do it in a timely manner. Okay? So I hope that makes sense to you, reasons to keep and reasons to cancel. I believe that everybody in a nursing home should consider signing up for a Medicare Part D plan. There's many that are free, and even the ones that have a premium, it's fairly small. Medicaid does allow for it, and Medicaid does not pay for prescription drugs. So if you do not have that Part D plan, there will be bills due at the nursing home. Okay, Medicaid doesn't cover prescriptions, but Medicare Part D plan does pay for prescriptions. So you want to ask the applicant's nursing home, hey, which Part D plan do I enroll in for the applicant, or do I get the applicant enrolled in? Some plans, again, are zero cost and some have a cost, but they're worth it. We believe in virtually all instances it is sensible to sign up for the Part D as recommended by the applicant's nursing home. Okay, so do ask the nursing home which plan works best. They'll review the file of your loved one to determine, hey, for the conditions they have, which plan's going to pay the best. How do you sign up for a Plan D prescription plan? Well, one, contact the agent we referred you to at the time you hired us, or you can look in the text of the email that sent you this video. The agent can advise you regarding keeping or canceling the applicant's policy, and they can sign the applicant up for a Medicare Part D, which will automatically disenroll the applicant from any replacement plan. Now remember, we mentioned replacement plans and supplement plans. It will not disenroll you from a supplement plan, but it will disenroll you from a replacement plan and kick back into Medicare. Now, if we sent you this video, we don't believe that you have a replacement plan, but if you do, that is the way it works. Obviously, we do highly recommend that you use one of the agents we refer you to. They're good at understanding what plan you have, whether it's a replacement and should be disenrolled, or whether it's a true supplement and should be kept. They can help you with which Part D plan. They'll know which ones the nursing homes are talking about, and so on and so forth. Again, keep in mind, you can re-enroll if you miraculously come out of the nursing home, or the applicant does, your loved one. They can re-enroll because it's a life change and a triggering event. So let's do a quick recap. Number one, keep your Medicare supplement insurance during your rehab days. I don't think anybody would argue with that. I'm not an agent, I'm not an attorney, but that's the way I see it playing out in every case I've ever witnessed. Keep it after the rehab days if paying the premium, in the example we use, $300, but whatever the premium is, doesn't interfere with paying the spouse at home spousal diversion. If you're a single person, virtually always makes sense to keep it, because it's either you're going to pay the income to the nursing home or you're going to pay it for the supplement insurance, and it makes sense just to pay it for the supplement insurance. If paying that supplement insurance is going to keep you from paying what you should to the community spouse, or the applicant paying what they should to the community spouse under spousal diversion, then you should consider canceling it. Okay? Enroll in a Part D Medicare plan. Do it based on the recommendation of the nursing home. They know what plan is going to work the best. And finally, consider using the agents recommended to you by Platinum on the paperwork. It's a referral sheet in the paperwork you got when you hired us, or you can get it from the text of the email that delivered this video to you. They are phenomenal at doing this right and making sure that there are no hiccups. So I hope this helps you understand why you may want to keep your Medicare supplement insurance, or the applicant's Medicare supplement insurance, or why you may want to cancel it. And it really boils down to, you want to keep it if it doesn't interfere with getting the income to the spouse at home if they need it and they qualify for it. All right, we appreciate your business. As always, we'll do a great job for you, and we are here if you have questions. Thank you so much.